Hi, this is Dr. Zadeh, and this is a little explanation about the guided system that we have for Implanova.
My name is Dr. Nima Astari, and I currently work with Dr. Zadeh for my implant training.
Something came to my mind. I just laser here, and we were wondering, how do these dental lasers work? Any idea, Doc? Lasers have issue of not having depth control. Now in dentistry, we always want to control the depth at which we are causing the reaction or doing the cutting or cautery. So what they have brilliantly done is that, for instance, this one, the dyed laser, the laser energy gets focused on the very tip of it, where we initiate with something that is dark in color. So that dark color gets energized by a laser and heats up. So the tip of the laser fiber will act like a cautery. That's how. So it's not the laser energy that is hitting the tissue. The laser energy is hitting the pigment that we put on top of the fiber, and that is what is actually causing that. Similarly, the water the laser energy would energize the water, and that water is what is causing the changes in the tissue. It's not the direct laser energy because, as I said, there is no means of controlling how far the laser rays would travel. I'll ask you a question.
A couple of questions I had was about the implants. So let's say we're placing a fridge, putting 6 implants on the top, number 3, 6, and 8 on one side, and then 9, 11, and 14 on the other side. So you put the fridge on. A few weeks later, patient comes in, and number 8 implant is failed. How do we manage that? Say a month later.
First of all, we have immediately loaded these implants, right? In other words, there is a temporary fridge on them.
Right.
Well, how do we know that one of them has failed at that early stage?
Just from x-rays, maybe. It starts bone resorption, it gets loose.
Okay. Once you place the temporary fridge on, you cannot remove it for 3 months.
Right, that's
so,
my question.
Yeah, so if it's failed, I mean, how can it fail? Do you see infection, just put them on an antibiotic. You need to maintain it for 3 months at least. And typically, if they fail, you won't know in a few weeks. If it fails, you will know only after the 3 months is up, and then you remove the temporary fridge, and that's when you notice one of them has failed or not.
Right.
So if at that time they failed, then you replace it. You can just eliminate that from the fridge, place another replacement implant, put the temporary back on, and wait another few months.
Got it. I had a question about the surgical kits that we have with the Implanova, and I was wondering if there is a fully guided surgical kit for these implants.
We do have the Turbo Guide tools as part of the complete surgical kit, and what the Turbo Guides do is that there are sleeves that go around the drill bits, and the advantage of them, and that's actually a patent feature, is that they carry the irrigating solution from the top of the guide to the surgical site that the drill is working. If you look at the picture I have on the screen, typical guides will prevent the irrigating solution from reaching the tip of the drill, and that's where heat develops and the bone gets damaged. Turbo Guide, though, from the direction of the flutes that it has, will carry this solution through the guide and on the bone surface. Now, these are the sleeves that I'm talking about, and even the implant can be placed guided by using the guided implant driver. So the way these work is that different drill sizes going different drill stoppers here, they act as stopper and also they act as directional guide for the drills. So when you say fully guided, all you have to do is ask the lab, or if you're designing it, just design the top of the guide to be 8 millimeters from the bone surface, and then all of these guides will fit. Different sleeve lengths for different length drills, because these act both as a drill stopper and a directional guide. This part of them act as directional guide, and then this is for the drill stopper. So these are for different size drills. This one is for the head drill, that is single size, and these are for this one for 14, 12, 10, 8, and 6 millimeter depth that we want to go to. So all we have to do is make sure that the top of our guide is, which is here, top of the guide is 8 millimeter from the bone surface. That's the only criteria. And this, because these flutes are not cutting and are dull, you don't need a metal sleeve inside the guide. See, a lot of other drills or guided kits, they need to have a metal sleeve, right, because the actual drill that has a cutting edge gets in contact with the guide. So that drill easily cuts the acrylic guide. However, the big advantage of the turbo guide system is that these flutes are non-cutting, and this is what goes inside the acrylic, and therefore because they're non-cutting, you don't need a metal sleeve. So in fact, it's less expensive to create a guide for Implanova than it is for other systems. And this is all you need, and these are reusable, and you can use your regular drills from your surgical kit with this system. You don't need another set of drill to use a system guide. Guided implant placement. Even the implant placement is most important to be able to be placed guided, because oftentimes you make the osteotomy exactly where you need it, but as the implant is going in, it starts to deviate and go a different direction. So with this system, the beauty is that you can actually place the implant guided fashion. Turbo guide sleeves can be used without the stent as drill stoppers. Now, even if you don't have this stent, you can use them as drill stopper. For instance, if it's above the nerve or under the sinus and you're not sure how far you go, you can use them as drill stoppers. And if you use it with this stent and irrigating solution, that irrigating solution is transferred to the bottom of the stent. This is the only system that does that. Usually this is a problem, and how the doctors compensate this, they ask the assistant to spray water separately here. So this makes life much easier and more reliable. This is how it would look when you have the sleeve over the drill.
So the stopper is right up here, right? So
the stopper is, no, this is the stopper.
So it stops right here?
Yeah, this is the stopper for the guide. This length here is 8 millimeters. So that's why I said the top of the guide should be 8 millimeters from the surface of the bone. This is the surface of the bone. So this here prevents your drill from going further in the bone. This here is supposed to be stopping the whole drill to go down by the help of the guide.
Yeah, the drill sizes don't change. Is
the drill sizes don't change. The length of this stem changes. So this is for instance, 8 millimeter. If it's for 10 millimeter, then this will be shorter. If it's for 12, then it will be still shorter. This use, you may need to go to a longer or shorter turbo guide for your desired measurement. The reason is some of the hand pieces that have higher torque, they have a little hex driver here. Now that makes these about 1.5 millimeters, 2 millimeters longer. So the best is place your sleeve and then actually see how far you have here. And depending on what you have, that will be your depth. If you think it's too short, go to the longer one. If it's too long, go to the shorter one, because the hand pieces chalk are different from one brand to another. This is the implant
That
placement
also
tool.
gets stopped. Has a stopper.
Yes,
Yes.
2 millimeter soft crystal. Yes. There is an optional metal ring too, but we have found that because the turbine portion is non-cutting, it's not necessary to have this optional ring. And yeah, the implant placement also has a stopper, which is this. This is the stopper for the bone, and this is the stopper for the guide.